Nobody open. Atlas. Mylohyoid muscle, together with the anterior belly of the gastricus and geniohyoides, they form the inferior wall. The diaphragm of oral diaphragm, like diaphragm which separates oral cavity from abdominal. We have diaphragm of the oral cavity, which starts from the mandible attached to hyoid bone. Mylohyoid. Mylo is Greek name of mandible. Mylohyoid. But also, what muscle lies here? Posterior belly, anterior belly lies from outside, from inside geniohyoides. They also form the floor, which is covered by the skin and mucosa, from oral cavity covered by mucosa. And very shortly study teeth, structure of each tooth, how many, what thing we can describe? Dentes, decidui or lactici, 20 in number, lactici, milk teeth, and permanent teeth, 32 number, 16 in upper row, 16 in lower row, and they have the principal tissue. From what tissues is composed the tooth? Dentine is the main tissue of the tooth. Dentinum, which the main three parts of each tooth has main three parts: crown, corona, cervix, column, cervix, and root, radix. Corona, cervix, radix. Corona is covered from dentine, from outside is covered by enamelum. The hardest tissue of our body is enamelum. 96% of inorganic substances form this, the hardest tissue. Bone is 70%, this 90%. That is why it is called also substantia adamantina. Adamant, do you know? Like brilliant, substantia adamantina. And the root is covered by cementum. In this cementum, by means fibers, connective tissue connected with dental alveolar. This fossa connected with the root by means periodont. Periodont is connective tissue around the root. Due to these fibers, what type of junction we have? Uninterrupted fibrous junction. It is gomphosis. It is one type of uninterrupted junction, but more correct. It is not correct name, gomphosis. Gomphosis means that something inserted inside, but our teeth, they erupted from dental inside. It is dental alveolar junction. We have periodont. Around the root, we have connective tissue fibers in different direction, vertical, oblique, horizontal, dentogingival fibers they have. And they have supporting function. They support the tooth inside the dental alveolar. On the apex of the root, we have foramina, apices, radices, through which the vessels and nerves pass inside and form, together with the connective tissue, form the pulpa coronalis and pulpa radicularis. Dental cavity, which form cavum coronalis and canalis radicis, dental canal, which is opened by the apex, is filled by dental pulp, connective tissue fibers, vessels, nerves, and cells. Connective tissue cells form together the dental pulp. Together with there's enamelum, dentinum, cementum, periodontum, pulp, the main parts of the thing, and together with the alveola, the part of the mandibular maxilla, dental alveola, and the gingiva, together they form structures which surround the root of the tooth. It's called parodont. This periodont, just inside the alveolar connective tissue fibers, together with the part of the alveolar process of alveolar part of the mandibular maxilla, together with the gingiva, structures which surround the root of the tooth, they are called parodont. What is bigger structure? Para or peri? Para. Periodont is part of the para. No, periodontit and parodontitis, you must distinguish. On parodontitis, in this process, what destroyed structure of what bony tissue also is more dangerous, parodontit, than periodontit. But the patient can lose teeth in periodontit because the supporting tissue is destroyed in this case. Thus, in oral cavity lies what organ? Tongue. No, and then dental formula by textbook read. I can explain in detail. So, in what level, in what order they erupted at milky teeth, at what ages? From 6, 8 months until 24 months, until 2 years. Children erupted they, and then loses and milky teeth and erupted permanent. But you must remember that inside the jaws, up and low, we have the germ of the permanent. When the milky erupted, their roots they diverge. They are short and diverge because inside we have the germs of the future permanent teeth. And this from 6 years start the first inferior molar. What type of teeth we distinguish? Incisors, canine, premolar, molar in number, dental formula. Then on horizontal line separates upper lower jaws, vertical line separates right and left side, and it is for the opposite patient. For example, the horizontal line, up and lower jaw, and vertical separates. It is for you. Thus, this side will be what? Left and right. Left is this, right is this. Not for me, for the patient. You'll describe. On each side we have 2 incisors, 1 canine, 2 premolar, and 3 molar. Yeah? Or you can use this incisive, canine, premolaris, molaris. Yeah, on each side. With letters, for milkier, small letters use incisive. Yeah? Or this arabский и римский, Roman, this nomen. Incisive, then says 1, 2, 3, 4 on each side we have, so 4, 5 on each side we have. Different type, 1, 2, 3, 4, 5, 6, 7, 8. Different, this is group name. 2 group incisors, there are 4, upper, 4 lower. This is all number of on each side, 8, 8, 8, 8, 5, 5, 5, 5. But in World Health Organization, another classification used. For example, там, the left, they use that 11, 12, там, как это, 21, 22, 23, 31, 41, 42, 43, all milky and from different numeration. Так, теперь tongue. Tongue consists of following anatomical parts: apex, anatomy of the tongue, apex, corpus, margins, superior surface of the corpus, inferior surface of the corpus. Значит, apex, apex linguae, margo linguae, corpus linguae, facies superior, facies inferior. Superior face, this surface, face to the palate, and it is called dorsum linguae. Dorsum linguae is superior part of the tongue, this dorsum linguae, dorsum linguae. And dorsum linguae has different development, from paired, unpaired, and between these differently developed parts we have sulcus terminalis. 2 thirds, anterior 2 thirds, separate from posterior 1 third. Presulcalis and postsulcalis. Sulcus terminalis separates, and foramen caecum on the sulcus terminalis we have. Sulcus medianus, two paired parts fused together during development, and inside we have septum linguae, which separates these two connective tissue plate, which separates these muscles of the tongue from inside. Septum linguae. Oh, good. Septum linguae inside. What muscles of the tongue we have? Musculus longitudinalis superior, longitudinalis inferior, verticalis transversus. It is organ of taste, organ of digestion, and organ of speech, articulation. Free function it has. It has not bone, it has intrinsic, proper muscle of the tongue, and extrinsic, which come from the bones of the skull. Tongue is located here, no? From free bones of the skull. What process is this? Styloid. What? Spina mentalis. And from the hyoid bone to the tongue goes free muscles, extrinsic, free pairs. Styloglossal, hyoglossal, genioglossus, hyoglossus, styloglossus. From the corresponding free bones, which pull downward forward, downward backward, and backward upward. Every time during deglutition, during speech, change position, become shorter, wider, narrower, due this muscle. Superior surface of the tongue and inferior, they are different structure. On inferior, which is shorter, yes, inferior surface. And on midline, you can see frenulum linguae. On both sides, you can see carunculus sublingualis, on which are open salivary glands. The main duct of the sublingual gland and duct of the submandibular. And you can see fimbria, plica fimbriata. On upper surface, dorsum linguae, you can see in anterior parts these different papilla, and posterior part, lingual tonsil, tonsilla lingualis. Here we have 5 types of papilla. Please, part of the tongue, part of the soft palate. Give notes and draw in your notebook. What 5 types of papilla we have? Papilla fungiformis, maybe lentiformis, like mushroom. Fungus is mushroom. It has head and trunk. Yeah? Papilla fungiformis or lentiformis. Lentiformis have the same fungiformis but flat head. Papilla foliate, like folia, leaves, sheet, foliate, on lateral sides. For salt, sweet, да? Lemon, when you eat, да? Papilla foliate, they have this irritation, да? Simulation, and papilla vallate, sour papilla. Papilla vallate from number 7, from 7 to 12, they are located in front of the sulcus terminalis and in front of the foramen caecum. These vallate, foliate, and fungiformis, they have the taste buds, and on this taste bud I ended different branches of the cranial nerves, and only 2 types of papillae, papillae filiforme et conice, they have touch and tactile function, but not taste buds. They have not taste bud. And due to this papillae filiformis et conice, tongue has velvet surface, but only fungiformis, foliate, and vallate have taste bud, due to which tongue is organ of taste. Behind we have tonsilla lingualis, which is immune structure organ. On 3 pairs of the salivary glands, we have parotid gland, submandibular parotid topography from zygomatic arch, superior body, to angulus mandibula goes. Where is located parotid gland? On lateral surface of the head, on mandibular branch, anteriorly and inferiorly from external acoustic meatus, on the ramus mandibula lies. From zygomatic arch to angulus mandibula. Nelia Alexeyevna, надо идти. From masseter to mastoid process and sternocleidomastoid muscle. Please, this blunt read, we have meet with chair department meeting.